Ladies and gentlemen, good morning, and I am happy to be here between you to talk about a subject which is an humanitarian subject about my country in Iraq. And at first I would to thank the professor about this exception and hospitality and giving me the allowance to talk to you about the health system in Iraq, especially during the occupation and the collapsing of this system after that invasion to my country. As you know, that the health system in Iraq before the occupation and exactly before 1990, before the first aggression attacks of the Americans to our country, it is considered to be one of the best health system in the region, in the Middle East region. And this is according to the report of the World Health Organizations of the United Nations. That is, the health system in Iraq is the best in the region, really, regarding the equipments of the hospitals, the number of the hospitals, the number of the medical centers, and the coverage, all the areas of the Iraq by the medical and health services, whether the prevention of diseases rather than the treatment and management and follow-up of the patients as well. Usually the Iraq health system characterized by presence and involving a high qualified doctors in the best colleges of the world. They are graduated from the famous colleges in the USA and the Britain and the South and the West and so on. So all these doctors, they did their jobs in high sufficiency and efficiency, really. This is before 1990, before the sanction that was illegal sanctions, which extended from 1990 up to 2003, when the invasion happened. Also, the system before 1990 characterized by eradication most of the infectious diseases. So we eradicate measles, we eradicate chickenpox, we eradicate hepatitis, viral hepatitis of the liver, and viral diseases of the liver. We eradicate many diseases which is infectious. So the public health is of high standard, really. So the WHO standard principles ranking the Iraq at the first, at the top, the Iraqi health system at the top of the health systems in the region, in the Middle East. All this before 1990. After the sanctions of the Iraq, which is applied to extend for 13 years, of course, everything becoming deteriorating, because there is massive and widespread and strict sanctions on Iraq in every directions. Every medicine cannot be entered to Iraq, and the manufacturing of the medicines started to be inside the Iraq, and sometimes can be brought to inside the Iraq from the neighbor countries by an illegal way, really. And then there is a deterioration, and there is displacement of these high qualified doctors and nursing outside the Iraq because of these bad situations. And this continue in the health system. Looks like the other system in the Iraq regarding the education system, regarding the social requirements and economic requirements all will be deteriorated during the sanction. And this continued, as I said, for 13 years up to 2003, where the occupation and the invasion, illegal occupation, unlawful occupation, and the criminal occupation happened at 2003 to my country. So constitute a big catastrophic event in the world, in the history, really. And it will stay in the memory of the generations for many, many 100 years, because everything is destroyed in my country, even the health system, which we will concentrate on it now. And the reality of the health situation in Iraq after the invasion and occupation really characterized by 4 stages, 4 phases, and these phases can be summarized as there is a stage of shock and awe and destruction. After the invasion happened in Iraq, so there is a shock for the people, and the Americans was named the war is the war of shock and awe. So there is a shock also to the hospitals as well, and shock to the health system as well as a part of the society. So most of the doctors were killed, medical doctors, and I know my friends that had been killed really in this war, illegal war, criminal war, without any reason. They are innocent people and peacefully working people, but because they said we are against the occupation, they were killed. Because they are said we are against the project of the occupiers in Iraq, they were killed. Because they said we need a humanitarian care, we need medicines, we refuse the attacks to our country, we refuse the killing of our people, they were killed also. I mean the medical doctors. So the number of the doctors who were killed in Iraq is 220 highly qualified doctors were killed by the soldiers of the Americans from one side, and by the militias related to the parties of the power from the other side, really. Well, the second stage of course, not only the medical doctors were killed, but also the academics, the educational academics, the members of the high schools also were killed. So the total number of academics in Iraq, including the medical doctors who are killed, are more than 500. This is according to a report which is constant now and registered in the United Nations organization, especially in the UNESCO and WHO and the Human Rights Watch Council of the United Nations. The second phase, as I suggest to classify the stages, is of normalization and deprivation. This continuous down level of the health environments and health system. Because of the attacks from the Americans against the different areas, including the hospitals and medical centers, under the cover that we are follow the terrorists in these regions, so the attacks hit the hospitals, and many nursing staff, medical staff were killed, were injured or captured, and so on, and put in prisons without any cause, really. And still some of them are there. Most of the doctors, according to this situation, will go away outside the Iraq. they run away outside the Iraq to preserve their life, to save their life or their family life as well. And you can find that now in Jordan or in Syria, Lebanon, Europe countries, Gulf, Arabic Gulf countries, many hundreds of the medical doctors and academics from of different specialties are there, leaving the Iraq and leaving their jobs just to save their lives and their family lives as well. So the other stage is the stage of change and targeting values and building alternative culture. And it is clear that every value in my country was targeted, any value, whether it is political, economical, social, moral, everything is targeted because, as I said yesterday, that is the occupation of Iraq is not a merely military occupation, but they came to change everything in Iraq, even the health system, even the educational system. The health system and educational system, as I told you, built during many years of building and reconstruction and qualifications and so on. So they bring some people who are really, they accumulated from the streets and say they are, well, academics. And later on, many organizations discover that they have no degrees, no high degrees at all. Even now the Minister of High Education in Iraq, who is called Ali Al-Adib, now the president, the current one, they discovered that have no higher degree in his graduation, no, at all, but have false degree. They discovered that, and it is became something shaming for him and for his party and government, because he is a party of he is a part of or a member of some political part of the power now. Yeah. The fourth stage is winning, investment stage, domination and exploitation of the country wealth, and linking the fate of Iraq by a full USA domination. In this stage that you can see that the Americans try to link most of the universities of Iraq in the American system only. And in this case, everything that who had graduated outside the American universities will be displaced away from our university. Usually the fourth stage is one of the eradication stages of the medical establishment in Iraq. And that is establishing its goals during the absence of the military occupation and withdrawal of the military divisions after they suffered huge losses and heavy costs and expenses due to the resistance of the people. Comes the stage to tie Iraq to treaties and agreements and binding them, and one of the most serious is the whipping of the National Medical School from the Iraqi minds and changing all its innovative and retrofit connections, and block them and their families by the culture of the Americans' medical system management and the process with all its negative consequences. Also, when the hospitals, some of the hospitals were closed during the operations, during the displacement of the doctors, during the losses of the nursing staff, because of the deterioration of the environment of the health system, they arrange some organizations and associations in Iraq now to collect the patients, the persons who are ill, and take him abroad for treatment, and usually to the USA, in order to get money, large amount of money, for example, to do appendicitis, removal of the appendix from the patients. The purpose is just to get money. In the facing or in the other side, they close the hospitals of the Iraq and collapse the health services. What happens in Iraq today? Yeah, this is a big question under the occupation regarding mainly the health system. And the health system, as you know, in general, it is related to the society in much deep relationship. The society and the health is in a close and in very cooperative relationship, because the economy enter in the health, the society or the social affairs enter in the health, the politics enter in the health, and so on. Well, I will give you some statistics now. I will answer about the question what happens in Iraq now under the occupation. First, we can say that there is a displacement and immigration of more than 70% of doctors and medical staff. More than 70% of doctors and medical staffs who are qualified well, we have are displaced and immigrated outside, as I said, to many countries, whether the European countries, that is the countries where they are graduated, return back, or in the Gulf countries, in the Jordan, Syria, Lebanon, and so on, Egypt. Wherever the doctor find a place for work or to live only, he migrated and displaced. The lack of budget allocations to be spent on health services that does not exceed 2% of the total authority budget. Now, the budget to spend that is specialized from the government for the health system is not more than 2% of the total country budget, which is not more than many millions of dollars for the health system in Iraq. So it is not sufficient even for to sell some medicines to one hospital in the any place. The other point is that the insufficiency of governmental institutions of health and deterioration of their services and the deviation of the citizen to private institutions, which have grown under the current circumstances in an uncontrolled manner. As I told you that there are growing up of private institutions, medical centers, and all these centers have groups, have agents to bring or deviate the patient from consulting the governmental hospitals to these institutions, the private institutions, and in corrupted way and uncontrolled manner, actually. The domination of the religious and sectarian parties on the joints of the Ministry of Health and its departments and the distribution of responsibilities on the basis of political and sectarian affiliation, regardless of efficiency, competence, and qualification. Even the job of the doctors divided between the parties in Iraq, parties of the power. Not according to the efficiency, qualification of the doctor, that person is with good qualification, good degree, high degree, and so on. No, but according to this is related to this party, and the other related to this sectarian division, and so this sectarian division and party is dominating and in power, so the followers should be get the responsibilities in the hospitals and health system. And this is, of course, on the expenses of the efficiency of the qualified doctors. So this from the, result in either most of the efficient doctors will be displaced away because they cannot work under unteached and low standard persons, and the second way, those persons who are take the responsibilities are insufficient and they cannot manage the hospitals and the health system. Because of the collapse of the infrastructure, such as power cuts for long hours and irregular supply of drinking water and cut off sewage system in all Iraqi cities, has reflected in a disastrous performance of hospitals and health centers. As you know that the infrastructure of Iraq is deteriorated now. I said yesterday the budget of Iraq during the last 5 years from the income that accumulated from the oil, because as you know that Iraq is floating on a lake of oil and it is the richest country in the world at all. Now there's no electricity. 500 billions. The budget is 500 billions USA dollars of the authority as general for the Iraq in the last 5 years. Only for this year is 100 billion is the budget. But there's no electricity in Iraq. And there's no clean drinkable water. And also the sewage system is not working in Iraq. And the accumulation of dirty everywhere now. And the poverty line and level really more than 50% of the patients are under this line, poverty line. So all this reflected also on the surfaces of the hospital and the health system. Exacerbate the problems of disability and injuries of war, bombings and malnutrition disease and poverty and psychological trauma disease and stress, addiction and the drug use and the lack of care to these patients with these impairments. There is exacerbation, there is a raising up the problems, including the disability of injuries of the war. As I said that many hundred thousands of the peoples now are handicapped and they are injured and they are suffering without care and without management and without follow-up for their life. In addition to the poverty, in addition to the psychological trauma from the war and from the capturing and the prisons and their, for example, a family lost the father or the mother who are in the prisons now, and many thousands of the peoples now in the prisons without pushing them to the court, without any cause really. Well, the Iraq characterized by, it is absent completely from anesthetics and from drug addictions and from some drug uses, addictives. But now it is widespread addiction for the drug use, and more of these anesthetics brought to the Iraq from Iran and from the neighboring region as well. Also, there is the genetic and congenital diseases, especially the diseases of the blood, like thalassemia, although there is some wrong in the spelling, instead between E is A, thalassemia, hereditary anemia, sickle cell disease, hemophilia, heart diseases, diseases of cardiac disease. Congenital malformations are a big problem in Iraq now, in terms of lack of means of diagnosis and follow-up and the treatment, because there is shortage in the ways and the equipments, and there is no updating equipments for the diagnosis, for the follow-up, for the treatment and management, and also there is no drugs for these diseases and for clotting factors. For example, the treatment of hemophilia, which is a hereditary blood disease, there is a deficiency of factor 8 and factor 9, and balloons and the plagues of stenosis and the slots, congenital heart attacks and others. Wrong selection of delegates for the purpose of training, competence and attendance of conferences, scholarships, and choosing the individuals is not on the basis of their entitlement or their efficiency, but on their basis political and religious affiliations, and how close to this party or that, and this sectarian division or that. Even the choosing the medical staff or nursing staff for the study abroad now, it is not according to their efficiency and their national working in the hospitals, but according to their relationship with the parties and sectarian divisions as well. The others, it is prohibited from, they are prohibited from the scholarships. Corruption of judicial device and politicizing in order to serve the power and to weaken the investigation and exploitation of the judiciary, and in order to hide the evidence of the crime, where the Deputy Minister of Health was kidnapped, and the burning of equipments and medicine stores happened many times in Iraq, and the proliferation of crimes of buying and selling of children. Now, it is a disastrous phenomenon in Iraq now. There is a buying and selling of children. And there's a report from the UNICEF about that in the United Nations. And the theft of a newborn from their beds in hospitals and sell them, and trading in children, and with a very low price, like $500 American per child. This is true in my country now, under the favor of occupations, really. And there's a report, international reports about that. can see from bad practices and harbingers of death, violence, rape, theft, and corruption in Mesopotamia is a pattern of a creative chaos and deliberate breach of ethics, value system, and infrastructure adopted by the invaders and occupiers. But the will of people in Iraq is stronger than the suppression. Real. The Iraqis have provided their children to defend, and their youth and their scholars and fighters to liberate their country and salvation of occupation. And this resistance, the national Iraqi resistance, caused the heaviest losses and most expensive costs for the invaders and occupiers, despite their weapons and their tricky plans and their large potential. These people will continue to give more and resist and struggle for liberation that sought for, which will be achieved by the will of God and the desire of His sons and His free people, and your support, and the whole God world that is with us and supporting us. Thank you, and all the brothers and members of this supporting campaign, to the people of Iraq against the occupation in Sweden and all European countries, for giving me this opportunity to talk and to clarify what I could on the situation on Iraq after the occupation. And all my thanks to you all for your humanitarian position and your solidarity with the peoples against the struggle for a better future for this world dominated by war and calamities and pain due to colonialism and dominance. Thank you very much for your attention and your hospitality. God bless you. Thank you.